normal and abnormal, and ICG and different disease patterns. Yeah, we are short of time, so whenever the 9:50 on dot we will stop. We have no financial interest. This is the requirement of the scientific committee. This is your first case that this patient, you can turn on the lights, no problem. First case is a 20-year-old female complaining diminution of vision for 3 days with headache for last 1 week. There are no systemic illnesses in this patient. Visual acuity is 21/25 in right eye and 20/50. In the left eye, anti-segment is within normal limits. What is your diagnosis? What do you expect on fluorescein angiography? Let us start the discussion here. Can you go with the microphone to the people? Yeah. Go with the microphone, active microphone, and give to that lady who is sitting in this third row. Third row. Yeah. Please come up with some diagnosis. No, patient has come to you. You cannot say no. Right? Yeah. Pass it on. What are you observing on the retinal examination? Here retina is there. The first color photograph you can see. Can you describe what you are seeing? This has been briefly presented by Dr. Lalit Verma. Same picture.
You can see a lesion in the macula, well-defined.
Not for your experience.
No, there's a well-defined lesion in the macula, sir. I don't see anything there.
Anything else? No, okay, this is the left eye picture.
See above the optic nerve.
The disc appears pale. Then there's a hyperpigmented, well-defined lesion in the macula.
Okay. So if this is the angiogram that is given to you, the patient said, I got the angiogram done and this is what they have given to me. They have not written the diagnosis. Can it lead to any diagnosis?
I can see some hot spots.
Hot spots.
And some.
Can anyone else will volunteer? That,
you can
guy in the green shirt. Yeah. Please take the microphone. Yeah. Thank you, madam.
Fundus photograph shows probably some the lesions are below the level of retina. So, and FA fluorescein angiogram shows some hyper.
There are different phases are there. This is the earliest phase of the all phases which are
increasing in size, and maybe some white dot syndrome.
White dot syndrome.
Yeah.
Okay.
Some form.
You see, white dot syndrome is diagnosed on color photography. So what does FA show? Multiple areas of hyperfluorescence.
Yeah, if this is the picture for the left eye. Anyone else? Yeah.
So is it active choroiditis?
Active choroiditis. Yeah, what form of choroiditis? It is a bilateral. I think they want to answer. Can you pass on the microphone there?
It's a Haradas disease.
Haradas disease. Excellent. So diagnosis is it's a bilaterality, young female, no systemic disorder. And what investigation would you do to confirm that it is Haradas disease in addition to this? Who has answered? You have answered. So you tell us what additional investigation for your confirmation.
On OCT we can see the multiple pockets of SRF.
Okay, excellent. OCT or B scan. Okay?
Yes.
You will see the choroidal thickening, which is a diffuse thickening, which will almost confirm you the diagnosis. Now let us move on to the next case. This patient is started on steroids and responded well. Now there is a 43-year-old male, sudden onset of blurring of vision for 3 months. Again, no systemic illness. Listen to the history. Started on oral steroids. Visual acuity not improved, unlike first case. Vision 2100 in both the eyes. and anterior segment is within normal limits. This is the fundus photograph. So who will describe? Other than that guy, who will describe this side? That lady from 5th row, this side. You go to the cream dress.
Ajit, show the FA also.
Yeah.
Show the FA also. Time is left.
Yeah.
Ajit,
Little.
if you point out people like this, they're not going to come for your course again.
This lady.
Multifocal CSR.
CSR, multifocal CSR, yes, excellent. This is the FFA picture which is showing multiple leaks, and this is the other eye confirming the diagnosis. This lesion, who will tell what it is? This area. This is abnormal. Okay, let us go on to the FA. What are you finding on FA? Is it choroidal or retinal lesion? Maybe you can give to that guy who is 2 rows behind. 2 rows behind, that side. Yeah, blue shirt. Yeah, yourself, sir.
So it looks like a choroidal lesion only.
Yeah, good. It is a choroidal lesion.
Yes.
One thing you need to be sure that it is choroidal lesion, not retinal lesion. Next.
So it may be a peripapillary choroiditis involving this.
Yeah, choroiditis. Why you are saying it is choroiditis?
So because it's early hypofluorescence followed by late hyperfluorescence.
Yeah, excellent. There will be an initial hypofluorescence followed by hyperfluorescence as the time progresses. And it is hypofluorescence and the level of lesion need to be seen. Here what is confusing in this clinical picture is that the disc edema, which is almost take your attention and miss this lesion. Okay, this was investigated and started on ATT, and this is the final picture of this patient, which was treated successfully and vision is recovered in this patient. Now this lesion, what is this? Again, you can answer.
Ajit, this is the last, I think we have
Last
finished.
slide?
Last,
Yeah.
last.
Okay. So this is again choroiditis kind, but etiology is
It
different.
looks like a tubercle granuloma.
Choroidal granuloma. Etiology is toxo, and treatment started and it has been healed. And a similar lesion, but this is CSCR. So it certain times, unless you give great detail eye to the patient examination, you may miss lesions. Thank you very much.
Thank you, sir.
And thank you all for participating in this instruction course actively. We always want it to be active, interactive session, and it found out to be very good, and people are very interesting. Thank you for all that, and I thank all my co-instructors for being with me and support you all through last 4 years.